Hi, my name is Gabrielle Yates, and I'm going to be inserting a Foley catheter on a female using sterile technique. Hello, my name is Gabrielle. I'm going to be your nurse for the day. Can you please tell me your name and date of birth? Charlene Knight, 8839, and that allergies latex penicillin betadine, and that matches the provider's orders. The provider's orders says that she needs to insert Foley catheter due to urinary retention, and the patient's unable to urinate. So, Ms. Knight, you've been saying that you haven't been able to void in the last 10 hours and you're having some urinary retention, so that's why we're going to be placing the Foley catheter today. So I'm going to inspect your peritoneal area to make sure that there is no problems and there's no discharge or anything like that that will cause me to not be able to insert the catheter correctly. So I'm going to lower the bed rail, and now I'm going to pull down her bed sheets, and I'm going to pull up her gown, and I'm going to inspect, and I can visualize the meatus, and there's no discharge, and there's no lesions or anything that will cause me from not being able to insert the Foley catheter. So now I'm going to palpate the bladder. And you're feeling some discomfort, so that's another reason why we're going to be inserting the Foley catheter. So now I'm down here. I'm just going to place it in the proper position. Like that. So now I'm done with these gloves, so I'm just going to throw them away and do my hand hygiene again. So I'm going to look at my box, and it's a 14 French catheter, and that matches the provider's orders. It has an expiry, expires 04/2017, and then the box is intact with no cuts or punctures or anything like that, and I would use a normal plastic bag or brand new one. I would never use one that's already open. So I'm done with this, so I can place this to the side, and I'm going to pull this out. I'm going to make this into my trash can. I'm going to place it at the foot of the bed. And now I don't need this anymore, so I can put it to the side. And I put this on a clean, dry surface with where it's not wet or anything. So I'm going to take my first flap, use my 1-inch borders. I'm going to pull it away from me, not crossing my sterile field. I'm going to take my left one and go out, and I'm going to take my right one and go out using my 1-inch borders, and the one closest to me I'm going to pull towards me using my 1-inch borders. And since it's hanging over, I'm going to come to the side without turning my back to my patient, and I'm just going to pull it this way without crossing my sterile field. So now it's like this, and I'm going to take my glue sheet by the shiny part, and I'm going to step back. I'm going to open it up. I'm going to move it around. I'm going to take it, shiny part down. I'm going to come over to my patient and drop it, just like that. And now I'm about to perform my sterile gloves, so I'm going to put hand hygiene on again. And I'm done with this, so I can move it to the side. And now I'm going to pick up my gloves and come over here and open them up. And they're backwards, so I'm just going to go like this. And I'm going to open them. I'm going to take my non-dominant hand and slide my dominant hand in, being careful, and pull it down and let go. I can fix it later. And now I'm going to take this, be careful not to put my thumb on it, and slide my hand in, pull it down, and now I can fix it. Careful not to break my gloves. And now they're done, and I'm done with this. I can move to the side, and I'm going to pick my white sheet up, and because I'm going to step back, but since my gloves are sterile, I can touch it all over, but I'm going to still try to use my 1-inch borders. I'm I'm going to come over to the patient. I'm going to go out and drop it and place it and let go. And now I'm going to come back to my box and I'm going to move it in the middle. And I'm going to take my hydrogen peroxide. I would usually use betadine, but she's allergic to it. So I'm going to step back and I'm going to open it. I'm going to pour it over my cotton swabs. I'm done with this, so I can throw it to the side. I'm going to take my lube. I'm going to step back and open it and pour it into here. And I'm done with this, so I can move it to the side. I'm going to take my syringe. I'm going to take it off. I'm going to pull back on the plunger to loosen it, and then pull up. Be careful not to squirt any water anywhere to get all the air out. And I'm going to close this up. And now I can move it to the side. I'm going to move this lobe to the side. And now I'm going to take the sheath off of my catheter. And I'm done with it, so I'm going to throw it to the side. I'm going to take my catheter and lube it about 2 to 3 inches. And then I'm going to place it back in my box. I'm done with my specimen cup, so I'm going to move it to the side. I'm not going to need it. I'm going to take my syringe and take the top off. I'm not going to need it anymore. And at this point, I would test my balloon, but if the manufacturer wants to, but this one doesn't, so I don't need to. So I'm going to attach it to the catheter port and then place it back in the box. And now I'm just going to grab this in the middle and place it back on. And now I'm just going to grab it and walk over to the patient, and I'm going to slowly let go without touching the patient or anything like that. So now I'm going to take my non-dominant hand and open the labia up, and it's become contaminated, so it's not going to move the entire sterile procedure. So I'm going to pick up my forceps, and I'm going to take one of my cotton swabs, and I'm going to go far labia and around and drop it. I'm going to go near labia and around and drop it. I'm going to go down the middle and around and drop it. I'm going to go far labia again and around and drop it. I'm going to go near labia, around and drop it, and then right down the middle one last time and drop it. So once I'm done with these, I can drop those as well. I'm done with this, I can move it to the side. And now I'm going to take my catheter port, and about 3 to 4 inches away from the meatus, I'm going to hold it, make sure that I don't touch the meatus at all, and make sure that my catheter doesn't touch it at all. So I'm going to slowly start to insert it, and I'm going to insert it about 2 to 3 inches until I see urine. If I see urine, so I'm going to insert it about 1 inch more. And now that it's in there, it's in the bladder, I can remove, the sterile procedure's over, so I can remove my non-dominant hand and secure it. And I can blow the balloon up, so slowly insert the 10 milliliters of sterile water. And once it's in, I give it a little tug. So it's in. So now I pull this closer and I unhook it, and this is done. So I can throw that out. So now my procedure is over. So I can come here and rip this off. Move it down. Now I'm going to take this and I'm going to attach this to the inner part of the thigh with a fastener that would come with the kit. And I would take the input and output container, and I would attach it to the bed frame and not the bed rails to make sure that it would never go above the patient's legs or above their ever. And then that would be done. So now my procedure is over, so I can clean up, and I'll make sure to assess input and outtake, which is how much she takes in, how much she puts out, and I would make sure to do catheter care at least once a shift or as needed, and I would also make sure to document